and today I will be demonstrating vital signs. So, vital sign, it is a measurement of the body's most basic function. It is a routine medical procedure that helps determine the internal functions of the body, which it helps monitor medical problems. And there are four main vital signs routinely checked by healthcare providers. So these are the temperature, the pulse, the respiration, the blood pressure, and the oxygen saturation of the patient. So the purpose of vital signs are to assess the health status of an individual, to understand the present health problem, to help physician prescribe the right treatment, to identify specific life-threatening condition, to understand effectiveness of the treatment, and to modify or change the mode of treatment. So these are the materials needed for the vital signs taking. So I have here an alcohol for hand hygiene. I have here a sphygmomanometer, my stethoscope, digital thermometer, a ruler, a pulse oximeter. I have here a cotton soaked in an alcohol. Then also I have here my pocket notebook. Then my ball pens, which are the black, red, and the blue one. And also I have here a watch with second hand. And also here is the patient chart with the TPR monitoring sheet in it. So before we perform our procedure, we perform hand hygiene first. So this will prevent transmission of microorganisms. So I have here an alcohol. And then next, we identify our patient. So this will ensure correct patient. So good morning, ma'am.
Good morning.
What's your complete name?
My name is Villaester.
Thank you, ma'am. And then we explain the procedure to our patient. So this will able to provide precautionary measures to ensure client safety. So ma'am, today I will be taking your vital signs as it is required by your physician. So it will include the body temperature, the pulse rate, the respiration rate, your oxygen saturation, and also your blood pressure. And then, of course, we provide privacy to our patients. So this, in order to provide privacy, then we close the door of our patient and then close the curtain of our patient. So now, we assess our patient into her comfortable position. So preferably by sitting. So assuming she is on her bed. So now we assist her to move her clothing or gown away from her shoulder or arm. And then remove the digital thermometer from storage. So to be able to provide precautionary measures to ensure clients' safety and also to have access to its sensor. So now we obtain the temperature. So we ask the patient to raise her arm away from the torso. So ma'am, kindly raise your arm away from your torso so that I can insert this digital thermometer accurately. Right, thank you. So once it is already in position, then we hold the thermometer probe in place until this will make a sound. Anyway, the beep indicates estimated temperature. So once we're done, so we take down note the temperature of our patient. So now, we wipe the probe or the sensor of this digital thermometer with an alcohol swab. So this will reduce transmission of microorganisms. Then put it in an receptacle, trash receptacle. And then return the digital thermometer to its storage. So this will give protection to the digital thermometer. So once we're done with the taking the body temperature of our patient, then we now proceed to taking the pulse rate of our patient. So first is the radial pulse. So since my patient is already in setting position, then I will just ask her to bend her elbow into 90 degrees and of course support it in this table. So ma'am, kindly bend your elbow into 90 degrees. So this position of lower arm with the wrist extended allow easier artery palpation. And then place tips of first 2 or middle 3 fingers of hand over groove along radial or thumb side of the patient's inner wrist. Like this. So fingertips are the most sensitive part of the hand for palpating pulses. So do not use the thumb to palpate. It has a strong pulse that you may confuse with the patient. So lightly compress the patient against radius. Then we now determine the strength of the pulse. So this strength reflects the volume of blood ejected against arterial wall with each heart contraction. So after feeling irregular pulse at the second hand of a watch, and begin to count the rate. So count the first beat after second hand hits the number on the dial. So prevents overestimation of the pulse. So count rate for 1 minute. So assess frequency and pattern of irregularity. So compare radial pulse bilaterally. So by the way, while we are taking the radial pulse of our patient, we could also take her respiration rate at the same time by placing this up in the upper abdomen. So this will save time and effort, especially in the hospital setting. Be sure that the patient's chest is visible for you to easily observe. Then observe the complete respiratory cycle. Then count the number of respirations in a 1 full minute. So once we're done, then we assist the patient into her comfortable or relaxed position. And then we take note the respiration rate and the radial rate of the patient. So after that, we now take the apical pulse of our patient. So first, we inform the patient that we will obtain her apical pulse, so to secure permission. So ma'am, I will be getting your apical pulse now. Is that okay with you?
Okay.
Then, we move aside the gown to expose the sternum and the left side of the chest. So, this will provide better access to the anatomical landmark of our patient. So, then we locate the anatomical landmark of our patient to identify point of maximal impulse. So, to allow correct placement of our stethoscope. Then, we use this equipment, the stethoscope. So, since nursing is an art, then we hold this like this. So, place the diaphragm of the stethoscope in our palm for at least 5 to 10 seconds. So, this will provide warmth to the metal of the diaphragm and to prevent the patient from being startled. Then, place the diaphragm of the stethoscope over the PMI at 5th ICS at left MCL and auscultate for normal S1 and S2 heart sound. So, we can hear the lub-dub sound. So, this will allow the stethoscope tubing to extend straight without kinks. Then, count rate for 1 minute. So, we note if heart rate is irregular and describe pattern for irregularity. So, once we're done, then we take down note the apical pulse of our patient. Then, we help our patient return to her comfortable position. So, this will provide the client comfort and sense of well-being. So, again, we clean the earpiece and the diaphragm of this stethoscope with the use of cotton swab or alcohol swab. So, one for this earpiece and then one for the other side, and then of course one for the diaphragm of the stethoscope. So this will provide or to prevent transmission of microorganism and to promote asepsis. So once we're done, then we will now get the oxygen saturation of our patient. So when using finger as monitoring site, we remove fingernail polish on one finger with acetone or polish remover. So this will ensure accurate readings, and also because nail polish may falsely alter saturation. So this, I have here the pulse oximeter. So, we attach the sensor probe to the monitoring site. So, pressure spring tension of sensor probe on peripheral digit or earlobe is unexpected. So we correlate oximeter pulse rate with patient's radial pulse. So double checking pulse rate ensures oximeter accuracy. So leave the probe in place until oximeter readouts or make a sound. So usually readings of this will take 10 to 30 seconds depending on site selected. So once it's done, then read the SpO2 on the digital display, and then of course take note on that. So remove the probe and turn oximeter power off. So store the probe in appropriate location. So sensor probe tension and sensitivity to disposal sensor probe adhesive cause skin irritation and lead to disruption of skin integrity. So once we're done with the getting her oxygen saturation, then we now proceed to the last vital sign taking, which is the blood pressure of our client. So we position our client in a comfortable position, which is sitting position, with her forearm at heart level or at a relaxed position, then turn palm up. Then we pull up the sleeves of our client to provide privacy to her arm. So placing arm above level of heart causes false low reading to mmHg for each inch above heart level. So we now get our sphygmomanometer. So since nursing is an art, so we put the cuff like this in a rolling manner. So ensures proper cuff application. So ensure proper cuff application because tight clothing causes conjunction of blood and can falsely elevate blood pressure reading. And then we palpate the brachial artery. So position cuff 2.5 cm inch or 1 inch above the site of pulsation. Then we place or position the manometer gauge vertically at eye level and no further than 1 meter away. So looking up or down or at scale results in accurate readings. Then we measure the pressure by placing the stethoscope so we ensure that the sounds are clear and not muffled. So proper stethoscope placement ensures the sound's reception. Then close the valve of pressure clockwise until it tight. So tightening of the valve prevents air leak during inflation. Then quickly inflate cuff to 30 mmHg above patient's usual systolic pressure. So, note point on manometer when you hear first clear sound. So, first sounds reflects the systolic blood pressure. And while gradually deflating the cuff, then note point at which sounds disappear. So, that will be the sound reflects on our diastolic pressure. So, once we're done, then we take note the blood pressure of our patient. Then, of course, we clean the stethoscope. So, starting from the side of the earpiece, then to the other side, and then the diaphragm of the stethoscope. So this will prevent transmission of microorganisms. So, we're done with our vital signs taking. So, after all the procedure, then we discuss the findings with our patient. So, ma'am, your body temperature is 36.7. Your pulse rate is 87. Then your respiration rate is 18, and then your oxygen saturation is 99%, and your blood pressure is 120/90. So which means all are normal. So this will promote participation in care and understanding of health status. And then, of course, lastly, we perform hand hygiene. Then, record vital signs in nurse's notes or vital signs flowchart here. Then, report any abnormal findings to nurse in charge or physician immediately if so. So, it is because data from incident reports are tracked for quality assurance and to allow the detection of emerging trends or problem. So, that's it. We're done with our vital signs taking.